Detox monitoring requires you to balance two critical mindsets. You are providing a compassionate, stabilizing presence for someone in a vulnerable state, but you are also executing a strict, timed documentation protocol. Your objective on the floor relies on three pillars: tracking specific withdrawal thresholds, securing client medications, and maintaining exact compliance with California state regulations. To do this safely, you must operate entirely within the scope of a behavioral health technician. Your authorization is strictly limited to observing, logging data, and reporting those findings. You cannot, under any circumstances, perform clinical activities that legally require a licensed healthcare practitioner. Staying inside this operational boundary is the primary safety mechanism at Emend. It guarantees the physical well-being of our clients while protecting the facility's operating license. Let's look at the actual rhythm of a shift. When a client enters Detox, you will take their vitals and biometrics every 4 hours for the first 24 hours. Once the initial 24-hour window has passed safely, the biometric schedule scales down to 4 times daily. Running underneath that 4-hour schedule is the Detox status log, requiring continuous observation every 30 minutes. If you spot any sudden health changes during these cycles, notify the practitioner immediately. This exact timing is an early warning system. It allows us to catch rapid physiological deterioration before it escalates into a medical emergency. To track that deterioration, we use specific withdrawal scales. Because these assessments involve sensitive health data, you will always administer them in a private office to maintain confidentiality. First is the Clinical Opiate Withdrawal Scale, or COWS, which measures the stability of a client recovering from opioid use. If a COWS score exceeds 30, contact the physician immediately for hospital transfer. For alcohol withdrawal, CWA has distinct thresholds. Over 15 requires physician contact and hourly reassessments. At 19, execute the emergency protocol, dial 911 and notify the physician. Memorizing these exact numbers removes hesitation during a crisis. You will know exactly which interventions to deploy the second they are required. During a shift, you will also monitor medication self-administration. At Emend, clients handle their own medications, but they do so under your direct, focused supervision. As soon as the client takes their dose, you log the observed administration directly into the electronic medical record. You then immediately resecure all medications according to the storage protocol. Controlled substances require strict, accurate counting every single time the lockbox is opened. You must also remain vigilant for unexpected events, such as finding a client with unauthorized pills or noticing signs of sudden impairment. If this happens, we use a harm reduction approach. Secure the unknown substance without making accusations, identify the medication, and notify the nursing staff. Combining physical security protocols with calm, non-judgmental observation prevents medication diversion while maintaining the therapeutic trust you've built with the client. All of these internal protocols operate within a strict state regulatory framework, California's Department of Healthcare Services Title IX standards for behavioral health. Under Title IX, transferring a deteriorating client out of the facility triggers a mandatory state reporting timeline. First, provide verbal notification directly to the department within 24 hours. Next, a comprehensive written report must be submitted within 72 hours. You have now completed the Phase 1 detox monitoring requirements. Next, you will perform a return demonstration evaluation to prove your competency with the CWA and COWS scales, as well as the medication protocols. By executing these precise cadences, tracking numerical thresholds, and reporting windows, you step out of the role of a passive observer and become the facility's most critical frontline compliance safeguard.